we will continue from where we ended yesterday. And I remember saying we should do that as an assignment. And let me just throw more light on it. I think we did varicose veins yesterday, and I think 4 or about 6 persons have done the assignment, and they have sent to me. I don't know why the rest have not done the assignment. So you endeavor to do the assignment, because even if I'm going to correct, I'll be correcting you those who did the assignment. They will be at a better position than you who did not do the assignment. And so there are some things I will not be able to say here. Like I will not, like question 3. You notice that the last part is talking about nursing care plan, discussing nursing care plan. That is what I will not do. And I don't know, maybe I forgot the question or something. So let's just go ahead. So we will be looking at this. Emphysema is one of the respiratory tract infection that causes these individuals to be admitted to the ward. Briefly explain the pathophysiology of this disease. Second, how can it be diagnosed? 2, that's the last. C, outline both medical and nursing intervention for patients admitted to the ward with emphysema. The first thing you need to understand, emphysema is a chronic obstructive pulmonary disease that results. It comes from the fact from the body fighting against itself. So it's more like an autoimmune disease whereby the immune system get to fight against the body because of foreign pathogens, because of foreign things that have come into the system and has triggered the release of some toxins. Like when I always try to explain this, I always give an example. I always tell students most of the time that, for an example, let's just take for an example that, let's say, a military officer has been killed. Let's say a BIR has been killed somewhere in the quarter or somewhere around your area. Now, when the military people come to that area to like investigate such a thing, they don't come there to even investigate. They beat everybody, whether you were involved or you were not involved, whether you were aware or you were not aware. They beat people mercilessly. The good, the bad, the ugly, everybody goes down. So this is what happens. There are some chemicals in the alveolus, and when emphysema it's actually a disease, like I said, it's a chronic obstructive pulmonary disease that affects the alveolus. It destroys the alveolus because the alveolus is the area where gaseous exchange normally takes place. And still in the alveolus, there are some chemicals. There are things like macrophages. There are things like neutrophils that help to protect the body system. And there are also some chemicals called proteases, and there are also some called antiproteases. Antiproteases are chemicals in the body, in the alveolus of the lungs, that help to prevent the action of proteases. Proteases is an immune chemical that helps to destroy, while antiproteases help to prevent the action of proteases. Like for an example, when you have been stung by a manawa, right, the place gets inflamed not because of the poison from the manawa. It gets inflamed because of your body system calming the mast cells, come there to destroy everything so that they can fight against the pathogen or the poison that has come into your body. So this is the same thing that happens. So now emphysema occur when there's an imbalance between proteases and antiproteases. Most often at time there will be more of proteases than antiproteases because of heavy smoking. Those who smoke much for a long time, it trigger the release. It trigger because now macrophages in the alveolus help to clean the alveolus from any disease or any infection. Now, when these foreign particles from smoking get into the alveolus, the macrophages now try to produce chemicals to try to cleanse it up. And one of some of the chemicals are called neutrophils, are the first line of defense in the body. And so, as it produces it, these neutrophils now, instead of trying to work according to the balance, like trying to understand the balance between antiproteases, it instead goes and produces more of proteases so as to destroy any foreign things that are coming to the body. And in so doing, when proteases are produced, they get to destroy and destroy more. So that is the analogy of the pathophysiology of emphysema. So if you don't use words like proteases and antiproteases, and you don't also say that they in a normal alveolus, there is a balance between antiproteases and proteases. Therefore, antiproteases try to prevent the action of proteases, so there's a balance. And then in the case of emphysema, there's an imbalance because proteases are produced more because of foreign particles from smoking or secondary smoking. You will be making a great error. So question 4, they said question that's 5 marks. You get a form 5 marks free of charge. How can it be diagnosed? How do we diagnose it? X-ray. You can do ultrasound. You can do sputum culture. You can even if you culture, you will not even find any bacteria. Are you getting? So you will not find any bacteria there. So what are we going to we do? We said, like I said, we will do X-ray. When you do chest x-ray, you also do pulmonary function test, you do arterial blood gas, you check for the presence of carbon dioxide and oxygen, and most often at time in a case like this you find more of carbon dioxide, making the whole alveoli more acidic, which is not supposed to be so, and hence you see the body resulting to metabolic acidosis, right? So that is what happens. So they say outline both medical and nursing management of patients admitted in the ward with emphysema. So they want us to look at how can we treat people with emphysema. Most often at time when such a thing occurs like this, we give bronchodilator because as the destruction is occurring, mucoids is being formed and the bronchi wall is reduced, and so we give things like bronchodilators and expectorants to release fluid, to release secretions. We also administer antibiotics because normal fluoride also will get involved in that, and at times we can give also diuretics to excrete the water, the fluid that has come as a result of the suction of the alveolus, and it may result to pleural effusion, which is not a good thing. And so what are the nursing care that you should advise the patient not to continue smoking, right? Mhm. Most often at time such patients, like some of the symptoms, if you look at the symptoms of emphysema, you notice that there is blood in, there's hemoptysis, blood in stool. There is mostly at time you may experience epigastric pain, right? And so most often at time, administer drugs as prescribed as a nurse, prevent smoking, advise the patient to prevent smoking. You can administer oxygen. You can encourage bed rest. You can encourage even sedatives. You can give sedatives, right? You can try to bring the patient to rest and all of that. So that is the nursing management of patients with emphysema. I hope we have understood. Now that's so. Let's get to hypertension, right? Hypertension. We said hypertension. Now, hypertension is a persistent increase in the blood pressure of a patient even at rest, and there are about three types of. It can be classified into three types. We have hypertension, we have hypotension, and we have white hypertension. Hypertension when there is an increase in the blood pressure of a patient even at rest. Hypotension occurs when the blood pressure is less than. Then we have white hypertension. It's hardly spoken. It's a type of blood pressure that only occur to patients when to people who go to the office. Immediately as the person enters the office, his blood pressure gets up, whether he's at rest or not. So that's another type. So we have, and there are two types of blood pressure. We have systolic and diastolic. And systolic, right, is always more than diastolic. So they say state the different drugs, the different classes of drugs used in the management of hypertension and their mode of action. And their mode of action. I've seen so many of you have done that, and that's very very good. When you do that, it 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 sticks. It sticks on you, and you will be the first beneficiary of that. You'll be the first beneficiary. Those who do not do, I encourage you to do it next time, right? So, and some of the classes of drugs that we use in management of hypertension, right? We have common diuretics, right? Diuretics is a type of medication that enable water loss, enable the kidneys to enable water loss from the body, because most often the time in hypertension the body tend to accumulate more of sodium and water, and so we give diuretics to excrete more of that. Then we have things like angiotensin converting enzyme inhibitor. We have angiotensin receptor blocker, angiotensin 2 receptor blocker. We have calcium channel blockers, and all of that. And now, now each of them have their various modes of action, right? Like when we look at calcium channel blocker, what do calcium channel blocker do? What do they do? Because in hypertension, the lumen of the blood vessel has been narrowed. It helps to relax the blood vessels. It helps to relax the blood. That is what calcium channel blockers they do. It helps to relax the blood vessels of the patient. And an example, you could be seeing things like amlodipine, right, and all of that. Then when you look at things like angiotensin 2 converting enzyme inhibitor, you will notice that it helps to also, it may, right, it prevents, it it helps to, like, if you understand the pathophysiology of hypertension, there's a formula I always give students. We have this uh, aldosterone, angiotensin aldosterone reaction, angiotensin and aldosterone reaction. There's something I'll recall it, then I'll come and explain the pathophysiology of hypertension. When I explain the pathophysiology of hypertension, you guys will understand why these drugs are like this. Not today. Please remind me in the subsequent days. Even if I don't say it, I will break it in a way that you guys can understand. If I start saying it here, it will take me a bit time because I need to explain the pathophysiology before we get to the drug so that you know why each drug is like that. Because when you understand the pathophysiology, you can easily know why the drugs are like that. In preparation for the nursing care plan of a patient, the first thing is to be able to identify the problem, right? The problem. In preparation of a nursing care plan of a patient suffering from hypertension. Now, hypertension is a medical diagnosis. Most often at time, nurses they bring their diagnosis with respect to the symptoms that the patient is experiencing. So, in a single diagnosis, in a single medical diagnosis, you can develop like 10 nursing diagnoses there. So now, what are the symptoms? The first is to identify the problem that most hypertensive patients go through. And what are the problems? The problems involve the signs and symptoms the patients go through. When you bring out the problems that the patient goes through, you develop a nursing diagnosis with respect to that problem. For an example, in most hypertensive patients, right, they have nerve pain, discomfort. What is the problem? A nursing diagnosis has three parts. We have the related to the problem, the related to factor, and the evident by. I repeat, the problem, the related to factor, and then the evidence to prove that what you are saying is correct, right? So what are we therefore saying? And you cannot develop a nursing care plan without understanding pathophysiology first of every condition. So I noticed some of you, I've been about 3 or 4 persons they have done well, and I really encourage that. So and continue to do that. So next in subsequent times, I will create a time for us to discuss at length about nursing care plan. When we discuss at length about nursing care plan, you can develop as many nursing care plans as possible. Write them as many as possible because it will help you as a student and it will also help you to be a prudent nurse in future because a prudent nurse is not known by the effectiveness of how you work, it's how well you plan. How well you plan. So that's what we will be seeing. So you give me time, we will look at that after. We'll look at the nursing care plan at length of this hypertension. There are many other nursing care plans, but often continue trying. When I'll come and explain what nursing care plan, will take a full session. I'll just discuss only on nursing care plan alone on nursing care plan alone because it's a topic that is most confusing. It always confuses students and it makes students find it challenging to be able to develop a nursing care plan. But when I explain it, some of you will find it very, very easy and easy to find it very easy to do.